One of the foundational institutions of the United Kingdom is the National Healthcare System, NHS, which provides free medical care, medication, and professional advice to every single UK citizen. Its long and intricate history dates back more than a century before it attained the well-known, outstanding degree of care and value recognised today. The UK's public health system is run by the National Health Service, NHS, established in 1946. The term, National Health Service, was first used by Liverpool-based physician Dr. Benjamin Moore in the dawn of the health age. After the Second World War, the National Health Service, NHS, was established and operated on July 5, 1948. It is the legacy of Aneurin Bevan, a former miner who became a politician and the then Minister of Health. It was initially put out to Parliament in the 1942 Beveridge Report on Social Insurance and Allied Services. The State Medical Service Association, which he founded in 1912, would establish the groundwork for a unified group of healthcare professionals. Before this, healthcare in the UK was typically reserved for the wealthy unless one could receive free care through charitable organisations or teaching institutions. David Lloyd George introduced the National Insurance Act in 1911, which allowed for the free provision of healthcare in exchange for a minor deduction from an employee's pay. However, under this program, only employed people received healthcare benefits. After the Second World War, an effort was made to establish a public healthcare system in which everyone was entitled to treatment, services were delivered free at the time of need, and central taxes were paid for services. The service was divided into hospital, primary care, general practitioners, and community services under a basic tripartite framework. A substantial restructuring effort was conducted in 1974 to enable local authorities to assist all three care areas in response to growing concerns regarding issues brought on by separating the three main care areas. The management structure was reorganized during the Thatcher years, and the National Health Service and Community Services Act, which established independent trusts to oversee hospital care, was approved in 1990. Since the Blair administration, there has been an ongoing change, such as the creation of NHS Direct, which aimed to raise healthcare standards while reducing costs and waiting times. As a result, the operating government management system was abolished in 2014, which resulted in the layoff of 30,000 administrators due to the subsequent changes in the NHS. Additionally, doctors were given discretionary access to 80% of the NHS funding. The reforms aimed to promote the continuous privatization of the healthcare sector to provide people with more options. The changes were made to assist reduce medical expenses and patient wait times. The National Health Service, a government-sponsored universal healthcare system, exists in the United Kingdom, NHS. Several publicly financed healthcare systems in the UK make up the NHS. It covers the NHS Scotland, NHS Wales, the Health and Social Care in Northern Ireland, and the National Health Services, England. Under this system, citizens have a right to health care and the option to purchase private health insurance. The NHS plan pledges to give patients access to more information and power in hospitals, beds, physicians, and nurses. It also promises to drastically reduce appointment wait times, improve treatment for elderly patients, and set higher standards for NHS organizations. A comparison of the healthcare systems of 7 industrialized nations found that the UK had one of the most effective systems worldwide. Quality, efficiency, access to care, equity, and leading healthy lifestyles were the 5 performance areas examined in the Commonwealth Fund report. Overall, the Netherlands came in first, followed closely by the UK and Australia. When it comes to access to care and care quality, the UK did well. The efficiency of the healthcare system, as determined by the amount spent on healthcare administration and insurance and the total amount spent on healthcare as a proportion of GDP, also placed the UK first. According to the report, the UK has fast wait times for primary medical care and non-emergency access to services after hours but longer waits for specialized treatment and elective, non-emergency surgery. The entire cost of healthcare as a share of GDP has generally increased during the 1980s. Butcher mentions that ever since the early 1950s, the healthcare budget in the UK has been rising by an average of 4%. Additionally, the private sector of health insurance has grown in importance, with 16.7% of healthcare expenditures in 1999, up from 10.6% in 1980. According to a Towers Watson analysis, medical trend rates were 6.0%, 9.3%, 8.8%, and 9.5%, respectively, in 2006, 2009, 2010, and 2011. By establishing the internal market in the 1990s, the UK government implemented one of the most significant transformations for the NHS in recent memory. To compete for patients, doctors must now be a part of the internal market. These markets were independent businesses that were run independently and engaged in rivalry. All healthcare in the UK was delivered by these trusts by the middle of the 1990s, with just 57 trusts. The NHS plan, implemented by the UK in 1998, assisted in modernising the NHS. The NHS still used a system from the 1940s to function in the 21st century. The plan was deficient in national standards. It lacked rewards and ways to boost performance. It was also overly centralised and robbed patients of their autonomy. Neoliberal reforms that are implemented gradually have strengthened the market worldview. These have splintered healthcare delivery and diverted public funds to the private sector's financial sheets, shareholder dividends, and profit margins. In the meantime, the NHS administration must cut expenses due to budgetary constraints. The NHS has been mandated to reduce costs and privatization as a purported mechanism to achieve this goal. The neoliberalism belief that input costs should be kept as low as possible while competition and the profit incentive must drive innovation and delivery has undermined the efficacy of NHS. 7% of the money went to private providers, up from just over 5% in 2011-12, according to Butcher, who claims that private companies currently deliver healthcare through the NHS. Although some NHS patients may receive particular services from private care providers for routine procedures like hip and knee replacements, the majority of care is given by the government and staffers who work for the NHS. For instance, according to the Centre for Health and Public Interest 2021 report, NHS approached private healthcare providers to alleviate the burden of COVID-19. However, research indicates that almost no COVID-19 patients were treated in the private sector despite 26 private hospitals benefiting from the contract. According to Gaffney and colleagues, the hospital building's cost has increased significantly due to the private financing proposal. In a sample of hospitals developed under the Private Finance Initiative, total costs, construction costs plus financing expenses, are 18 to 60% more than building charges alone. Further, Gaffney posits that investing through the Private Finance Initiative is more expensive than buying from the government. While the government can borrow at interest rates between 3.0% and 3.5%, the annual fee for using privately funded facilities ranges from 9.1% to 18% of the building cost. When comparing the costs of the private finance option with public sector investment, the Treasury insists that NHS trusts discount expenses at 6% annually, concealing the higher cost of private financing. The amount of risk passed to the private sector under privately financed deals has been overstated, resulting in erroneous claims that private sector options are more valuable. The NHS and the private healthcare sector have always been competitive, but this competition is not conducted on an even playing field. The NHS has trained the vast majority of clinical staff that works in private healthcare, mainly with taxpayer money. Private healthcare providers do not cover the expenditures of this training, whether direct or indirect. Private healthcare providers can avoid making such obligations because they can offer 24/7 services, not just in A&E but in most other medical and surgical specialties. NHS hospitals benefit less from how VAT is applied to numerous pharmaceuticals, devices, and equipment than private hospitals. When competing for contracts to provide care for NHS patients, private health providers can undercut NHS providers due to all of these considerations. The cost of delivering round-the-clock emergency care is largely subsidized in many specialties by the money from a consistent flow of predictable elective and outpatient work. There is a good chance that local hospitals will not be able to continue offering the urgent care that people have come to expect if elective care is leased out to commercial providers. It affects training as well. If this work moves to the private sector, it may take much longer to develop the expertise and confidence of the next generation of surgeons. Surgeons in training need exposure to the learning that comes from operating, under proper supervision, on patients in the controlled setting of regular operating sessions. The first recommendation is related to the possibility that increased NHS privatization and the provision of healthcare services for profit could lead to worse population health outcomes. As a result, it is advised to change course, expand the public and NHS sector's provisions, and engage in significant political intervention. The second recommendation entails restructuring the NHS market. Restructuring the NHS market is essential, and the UK's private sector must also be closely examined. We conclude that there should be very little corporate involvement in enhancing the country's healthcare system. Thank you so much for watching. If you've enjoyed this video, like, share and subscribe to the channel.